Welcome to the McIntyre Report. These are the extraordinary stories of ordinary, everyday individuals. Today's guest is the owner of Oak Testosterone Clinic, and he specializes in the three things that I'm in the market for: hair loss, testosterone replacement therapy, and weight loss. Ladies and gentlemen, Mr. Yes. So you are the owner of Oak Testosterone Clinic.
Yep.
You have your own podcast. We're going to talk today about hair loss, which I'm dealing with.
Okay.
We're going to talk about TRT, which I'm also in the market for,
Okay.
and which many guys around San Angelo are, and maybe weight loss too. So that's kind of encompasses everything you do, right? I'll let you tell us.
Yeah, we have a couple other little things that I'll kind of term like regenerative services, where I'll do
Okay.
like PRP injections and have an electroshock machine. And
Whoa.
I like that because it's not an injection, but still promotes growth and healing factors to areas of pain, like
Whoa, okay.
tennis elbow,
Mhm.
golfer's elbow,
Yep.
whatever pain you have, it just helps. And so we kind of have a couple other regenerative things, but I mean, our bread and butter are hormones and weight loss, and just kind of for the general public on just really day-to-day living
Yeah.
and trying to get that healthy lifestyle back that
Yeah.
is just hard to do these days with everything that we
It sure
have.
is.
And so we kind of talk about it, and we check labs, and that helps kind of guide us with things. Labs aren't the end all say all,
Okay.
but they give us a baseline with a lot of things.
Yeah.
You know? I like a comprehensive set of labs, and a lot of times people go to their primary doctor and they're kind of struggling,
Mm-hmm.
you know, low energy, fatigue, poor libido, just not quite what they used to be. And they run a pretty basic set of labs, and they're like, you look good, just come back in a year.
Yeah.
And so that's really where I was like, okay, we need to dive a little bit further.
Mm-hmm.
And even sometimes with, you know, hormone replacement, it's, you know, you may have normal numbers, quote unquote normal, but
Yeah.
man, you just do so much better whenever they're optimal.
Right.
And it's largely symptom driven. Like,
Okay.
you know,
Yeah.
we have like guys fill out what's called the ADAM questionnaire, the androgen deficiency in the aging male.
Okay.
It's an acronym.
Yeah.
And that kind of gives us a subjective response to go with their numbers, you know?
Okay,
And so
yeah.
even if you have normal numbers, a lot of times you can feel better, just almost break out of the that's the way we have guys. So it's like, I feel like
Yep.
I'm me again.
Right.
Are you looking to elevate your brand with custom headwear? Custom business hats for high quality customized hats, perfect for any business need. Whether it's for company branding or distinctive merchandise, we ensure that your brand gets the attention it deserves. Plus, we offer free quotes to help you get started. Visit our website at custombusinesshats.com. Custom Business Hats. We've got you covered.
Hey guys, pardon the interruption, but if you wouldn't mind hitting that subscribe button to show your support, we'd be very appreciative. Now back to the episode. Yep.
And so that's where a lot of times we come in and help kind of achieve that and help them get them going to that,
Yeah.
and at least working on.
Okay. Dude, that's awesome.
Yeah.
So give us a little background. For those who don't know, you are a nurse practitioner and you worked at Shannon, you said, for like 10 years, right?
Yeah.
So tell us about that and then how you kind of opened the clinic. Yeah.
Yeah. So, I mean, I've been with Shannon. I started there in 2012 as a tech in the emergency department while I was in
Nice.
nursing school. And then I worked in the ER and ICU as a nurse while I was in nurse practitioner school.
Cool.
And then my first job as a nurse practitioner was in orthopedic surgery with Dr. Mole here
Yeah.
in town.
I love Mole. Yeah.
Yeah, he was awesome. I learned a lot. I love ortho.
Yeah.
But the on-call ortho life where I'm at the hospital 100 hours a
Constantly,
week,
right. Yeah.
surgeries 2, 3, 4 a.m. in the mornings. I couldn't do it long term. So
Yeah.
I was very fortunate that the ER had an opening at the time. So I went back to the ER for another 4 years.
How was that? The ER, was it intense? I mean, was it pretty cool?
Man, I loved it. I mean, that was where I was there for about a decade, and you just get to see everything, do everything. I got to do a ton of procedures, a lot of hands-on stuff, and I loved that.
Yeah.
I was alternating days and nights, and I just truly got burned out of having to stay up all night and flip-flopping my schedule back to working days, and I just burned out. So then I went to urgent care where it was just strictly days.
Yeah.
So I did that for a couple of years. So really the bulk of my background is in what's called acute care, where I'm taking care of you where you're sick, something happens.
Yeah, okay. Yeah.
And so starting the clinic, I really wanted to kind of even back up, like keeping healthy people healthy is something that traditional medicine doesn't do a very good job.
That's right.
at.
Yeah.
And so I was like, okay, let's see if we can optimize this and kind of go from there. This work I do with people now prevents that emergency department in a decade, 20 years. Everything. And then so it kind of started that way. And I used to be men's health only. That was what I started.
Yeah.
But then the GLP-1 medications like semaglutide, which is like Ozempic or Wegovy, tirzepatide, which is like Mounjaro, Zepbound, they came out. And I was just kind of treating some wives of my male patients, and man, they're just so safe, so effective. They had such good results. It just felt better. And I was like, okay, well, I don't need to scare off women, so I started doing men and women weight loss.
Yeah.
And then we did weight loss only for a little bit, like the female hormone optimization.
Yeah.
It's pretty new. We've really just started that this year.
Okay.
I was getting training myself kind of in the background for over a year and a half. Even whenever I first started the clinic, I was getting some female stuff, but I was just kind of intimidated, honestly. But once I was working with them with weight loss, and it's still just missing that piece. And I was kind of telling them, like, I think you would do really well with hormone optimization. I'm not doing that. See if your PCP or your GYN would take over and help, and then we can help facilitate with weight loss. And they were just kind of coming back frustrated and not getting where I wanted them to do. So I was like, okay, this is just something I need to bring on by myself. Do it right, do it how I want to do it, monitor them appropriate. And so that's kind of how now we're kind of all encompassing.
I like
with
that. Yeah.
We have a big dermatology part that's both medical dermatology and aesthetics.
Okay.
Addison Ritchie is a nurse practitioner, has been in derm for 8 years. And so she's awesome and just acne, rosacea, skin checks. I mean, she cut off a thing in my head.
Oh, yeah. I was going to ask if she does that. A skin tag one time I had cut off.
Yeah.
Yeah, she does that.
Yeah.
Cool.
And she's awesome. She's easy to work with. And then she also is really good from the aesthetic stuff. Neurotoxin, filler, microneedling, chemical peels, medical grade skincare.
Whoa, she does all that?
Yeah.
And so hair loss falls under dermatology? Okay.
Yep. Yeah. And so that's another thing that she'll do. And also like social media, and being a guy, I didn't really know, but social media with these girls will get them on these 12 to 15 step skincare things. And she really will come in and help just simplify it.
Yeah. That's
like,
cool.
You just need this.
Yeah.
You're tripling down on this. Stop this. Just doing that can save a lot. And then hair is kind of the same deal. I had somewhat of a hair protocol, but she helped kind of come in and make it much more evidence-based and give us some more backing with it. And everything.
Yeah. So, very cool.
Yeah.
So let's jump into this. So I'm kind of your primary candidate when it comes to treating males. I'm a 38-year-old guy. No, I'm a 39-year-old guy. And I am probably at that point in my life where my testosterone is starting to dip a little bit. I've been in the competitive bodybuilding industry for a long time, in the fitness industry for a long time. Experimented a little bit with testosterone, nothing crazier than that though, really. Okay, so, that's probably something that there are some guys who've done that, that you probably deal with. And that's probably important to know right out of the gates, is it not?
It is. And it depends on how young you were. Like, I mean, I have guys that have like kind of truthfully, the guys that I've seen do later, like 30 plus and kind of experimented for short term, get appropriate post-cycle stuff, they're okay. I mean, they're not typically tanked. I've had a couple who even in their young 20s just kind of experimented and you're just not quite set up from what's called the hypothalamic pituitary testicular axis.
Whoa.
It's just not as mature until you're about 25, 27. And so if you're just kind of experimenting willy-nilly,
Yeah.
you can disrupt that axis. And so I've had a couple with that.
Yeah.
But man, I've also, when I started my clinic, I thought my population was really going to be more 50 to 70.
Yeah.
Really, the bulk of my stuff is guys are 30 to 50.
That's what I would think.
And
Yeah.
it's not uncommon for me to have a mid 20-year-old with documented low testosterone
Whoa.
and never done anabolics or anything.
Really? Well, that's what I was going to ask you is who is like your avatar? Like who is your primary guy? Is he, how old is he? What is
I would
he?
say the primary is about 35.
35-year-old, like young professional type guy or
Yeah.
oil filled or what?
Yeah. Just these guys that have just been truthfully killing it for the last 10, 15 years.
Yeah.
They've been stressed. They've, started a family.
Yeah.
They've been working on their career.
Yeah.
It's kind of been under high stress for 15 years and just kind of forgot to look back at themselves.
Yeah.
And then
okay.
all of a sudden it's like, man, I'm kind of struggling to get through my day.
Yes.
At the end of the day, I'm just coming in home, collapsing into the couch, not real interactive with my wife and kids. And
yeah. Are those talk about that a little bit since you touched on it. Like what are the primary symptoms of low testosterone? What do they experience?
A lot of times it's a low energy, low drive, low motivation.
Okay.
And then the sexual stuff is a hit or miss.
Oh.
Meaning I've had guys with super low testosterone have zero problems with libido, erectile
Interesting.
function, that kind
Yeah.
of stuff. But I've also had guys have good testosterone who struggle the most with libido and erectile stuff. So it's not always directly correlated.
Okay.
But that is a reason why I would bring testosterone
Yeah.
on with a guy, because some sexual decline.
Okay.
And then from like a fitness standpoint, poor muscle gain, poor muscle recovery, increased fat around midsection, that kind of stuff. And that doesn't mean that you start testosterone, all that goes away and you look like Arnold Schwarzenegger, that kind of stuff. You do kind of have to put the work back into it. But man, starting testosterone a lot of time is that catalyst that the guy needs to get
That's what I hear.
back
Yes.
into the gym. It rewards you for the work you put into it.
Yes. Okay. That's a good way of putting it.
Yeah. And so a lot of guys, the more you put into it, the more you'll get out of it as well. And
It's
so
like anything else in life, I guess.
Yeah.
Yeah.
And then it's like, I'll follow up with them. And one of the most rewarding from my end is like, the guys are like, man, I broke out of the shells and I'm me again.
I hear that all the time.
Yeah.
You know who just told me that one of the best testimonials that you have, I think, just from what I heard, is Rusty Bartolomeo. You know Rusty?
Yeah.
Well, he won't mind me saying that because he came on here to talk about it.
Okay.
Because I asked him about it. And we saw each other in the gym, and we've kind of known each other, but not that well. And we started hitting it off, and he decided to come on the show. And one of the things we talked about was him doing that. And he was like, dude, it's like I'm a new guy. Like, he's like, this is what I needed to, now I get up and like, I can't wait to get after the day, and it's like helped my mood and like everything across the board. And I was like, dang, dude, like he feels like he's Superman.
Yeah.
And I heard that from a few different people. And I mean, that's pretty cool that like that can be the key that's missing, and so what are on the other side of the spectrum then, if those are the symptoms, then what happens whenever someone has low T, they come in, you start them on a regimen, what do they experience? What are the things that it helps?
Yeah. And so I try to essentially undersell and overdeliver. Like I don't want to always say, I have guys have amazing results, but sometimes it takes some time, and so I try and set realistic expectations and just hope they are a kind of hyper responder and everything.
Yeah.
But even if you don't have much, like even if you improve, a little bit, it is still just better energy, drive, motivation. You start pushing through plateaus that you're stuck at the gym. Okay. You're recovering better.
Yeah.
Erectile quality typically improves. Sometimes they're like, I didn't even know I was declining, but it's much better.
Wow. Yeah.
Now. And so
clarity too, I hear. Clarity of mind. Yeah.
Yeah. The brain fog dissipates, and it's just, they're like, I'm able to see through the cloud and think again. And so, and so we go along, and then on the, not the worst side, but say they don't get these. Yeah. Then it also lets me know, like, okay, is there something else?
I see. Yeah.
What is kind of holding you back?
Right.
And sometimes we'll uncover, it's just, sometimes counseling is needed. Sometimes it's too much of chronic stress, or they've gone through a significant event, or they're still drinking 8 to 10 beers a night.
Yeah.
Smoking undoes a lot of the testosterone benefits. And so we try and piecemeal, like, you should probably be feeling a little better from the results we have. Is there anything that we need to address that we're not getting, And so that's another thing we'll just kind of dive into. And we get a pretty comprehensive set of labs at every follow-up. You know, I'm going to check your blood count. Testosterone can cause what's called secondary erythrocytosis.
Is that the increasing of red blood cells?
Yep.
Yeah.
It's a fancy word for more red blood cells. And a lot of times
the blood, right?
Yep.
Yeah.
People were worried that that's going to cause increased strokes, heart attacks.
What do you think about that? I mean, is there valid concern there and like research that backs that up that it's probable, or is it small risk?
It's a much, much smaller risk than everybody really attributes.
Okay,
to.
that's good to hear.
We luckily had this study that came out called the Traverse trial, and it gave testosterone to very high risk guys, and they did not have an increase in any cardiovascular outcomes.
Okay.
So this happened in February. The black box warning on testosterone worsening cardiovascular outcomes was removed.
Really?
Yeah.
When did that happen?
Just this year.
I didn't know that. That's fascinating to know. Wow.
Yeah, and so that's awesome. We now know that low testosterone is an independent risk factor for worsening cardiovascular.
Oh,
disease.
wow. Okay.
And so guys even with heart failure will get better kind of aerobic capacity, meaning they can walk further and that kind of stuff.
Yeah.
Than if they had low testosterone. So it's like we're almost undoing a lot of the old scared, fear studies that we had. Prostate cancer was something
that's right. What about that? Any validity to that?
Right now, it's hard to say anything is 100% disproven in medicine, that kind of stuff, but it is almost disproven.
That's
Luckily,
so good to hear, man.
Yeah, there's a doctor with Harvard. His name's Dr. Morgenthaler, and luckily he was kind of the pioneer in going through, and he was, cavalier enough to put guys that he was monitoring with prostate cancer on testosterone.
Okay, yeah.
And they were not having worse outcomes, that kind of stuff. And so it's called the prostate saturation model. It means that I'll kind of back up. This may be a little too much information.
That's okay. Yeah.
They thought testosterone caused prostate cancer because if you remove testosterone, the prostate gets smaller.
Okay.
And so it's like, okay, well, no matter how much testosterone you have, it's just going to grow.
Okay.
But it gets to a point, and that's a level of about 200, 250 of testosterone, which is low.
Yeah.
And so anything above that, it's not getting any bigger.
Oh, so what you're saying is there's an initial little growth to it when starting testosterone, but then it caps off?
If you're below 250.
Okay.
Most guys are a little above it anyways, so there won't be
any growth. Oh, okay. Great way to describe that. Explain that. I see. So, that was a big, and it's funny because like over the years in the fitness industry, testosterone replacement therapy, especially in San Angelo, because we're behind 10 years always as it is anyway.
Always,
what I mean? Yeah. And so men that I would work with that were a little older, I would suggest that, have you had your testosterone levels checked? Yeah. And just the mention of starting something like that would freak people out. Like,
it was almost offensive.
I would never do that. It was almost offensive. I'm not going to do steroid, like freak out about it.
Yeah.
And even to a point, like some of my older school clients kind of still feel that way. And I'm like, no. Like this is like a mainstream deal now. Like this has been tested clinically, like on hundreds of thousands of people. Like it's pretty safe now,
Yeah.
There's experts in now.
It's a positive for health these days.
That's right.
It's not a negative. It's not like, and it all stems from a lot of the old bodybuilding stuff where
it does. Yeah.
they're doing high dose testosterone,
multiple compounds.
Multiple compounds.
Yeah.
And, at the end of the day, substance abuse is substance abuse.
That's right. That's right. So, good point.
And so medically managed, controlled testosterone doses are overall net positive for health these days.
That's what people need to know right there.
Yeah.
And what about, so let's talk about this, segue into women. So there are women who need TRT, right? Their testosterone's low and they could really benefit from that, right?
Yeah, and it's just, I'm really learning it's just like guys. There's something... There's something poisoning all of us in our environment these days, and there's probably not one thing anybody can point the finger to. It's just we now live in this, pool of fertilizers, chemicals, that kind of stuff, and microplastics, and you limit when you can, but at the end of the day, I mean, like mid-30s guys, it is shown to start probably back in utero even. So it's not that you can undo all of it
Exactly.
in 2 weeks of trying to eat better and go to sleep and stuff. But women kind of are the same thing. They're just almost low in not only testosterone, but progesterone.
That's what I've heard. Yeah. Okay.
And sometimes it's from the birth control, and nobody bats an eye to put a woman on birth control, but you talk about hormone replacement in a woman and everybody freaks out.
That's exactly right. Yeah.
And I mean, birth control is high dose hormone therapy in a woman. Whereas, it's kind of the same with, as I was talking about with guys, managed appropriate doses of testosterone in a woman does them amazing.
It does. And I've seen it firsthand with clients. And I want to ask you about administration, like how you administer it, whether it's intramuscular or the pellets, because I've had female clients mostly do the pellets and I've had most male clients mostly do intramuscular injections. So, but the other thing is I wanted to touch on is there is still that misconception out there that women have that if they start doing testosterone, even if it's managed correctly with a professional, that they're going to develop a deep voice and hair on their butt or nipples, whatever, all the stuff that comes along with it. So can you dispel that? I mean, that's not true, right?
Well, I mean, it is to an extent, but it's typically as long as it's managed okay, you should be okay.
Okay. Yeah.
Some will be more sensitive to just get a little bit more. It's called hirsutism. Is just a fancy word for abnormal hair growth in women.
Okay, yeah.
And so sometimes we get a little bit of more of a mustache. It's not going to make them like me.
Right, yeah. Yeah.
And as long as your doses are managed, okay, you should not get a deeper voice.
Okay.
And if you do, it's typically reversible.
Okay, I see, yeah.
And, for the most part, acne is another thing that can happen with a woman.
Talk about that, yeah.
It's typically like chest and back. It's not going to break out their face or anything. And it's typically pretty well controlled.
Okay.
Like, I would say we have not had anybody discontinue treatment because of acne.
Okay, great. Yeah.
We probably have more women scared to start treatment because of it. But once they're going, almost nobody, I don't think we've had anybody drop off because of acne.
Wow. Cool to hear. Is that more likely to happen with men than women, the acne thing?
It can happen with guys too, and typically it's pretty mild.
Yeah.
Again, with testosterone doses, typically chest and back, it's not face.
Why is that? Do you know why right off in? Why it's...
Yeah, it just makes you produce a little bit more oil. And so sometimes it just predisposes you to having a little bit more skin bacteria get caught in it.
But more so on your chest and back than your face?
It's just different oil producing hairs.
Okay, follicles and stuff,
Yeah.
Interesting,
And so we'll change dose or frequency, or luckily Addison, again, being dermatology, has helped me expand my treatment if changing dose, frequency, or carrier oils doesn't change.
Okay,
management, she's kind of helped get us a little bit deeper protocol just for management of that if it comes
cool. And when it comes to either the injection or the pellets, do you give them a choice or does it depend, or how does that work?
So I don't do pellets at all.
Oh, you don't do that? Okay.
I don't like pellets. I don't like pellets.
I don't either, man. Like from what I've read about it.
Yeah. They're like a place and pray, meaning if you got the dose good, it may be okay. But if it's wrong, it's wrong for 3 to 6 months.
Exactly.
And I can't adjust it. If it's too low, it's a procedure where I'm creating more scar tissue and got to put more pellets. If it's too high, you can't hardly get them out.
Yeah.
Any procedure carries a risk for...
Sorry.
No, that's okay.
What is that? Is that a phone, Dad? Oh, is she here? What were you saying?
Yeah, no.
Sorry
So
about that.
any procedure carries risk, of course, and so I'm going to always choose the least risk, most effective
Right.
option.
Okay. Yeah.
And men and women, it's just there's too much extra variable risk. The pellets can pop themselves out. You can get what's called a seroma, a little fluid collection. You get a small chance of infection, very small, but it's there.
Yeah.
And then if hormone therapy is long term, if you do 30, 40 years of pellets, that's a lot of scar tissue.
Yeah, there's no way, right? That'd be horrible.
Not a
pick up right there.
I'm not a big fan of pellets for just kind of long-term therapy, just from the negatives that I mentioned earlier, mainly that I can't control it.
Exactly.
Injections and creams I can control.
Okay.
And so those,
creams you can?
Mhm.
Interesting. Okay.
Yeah, and the creams are a very good option
Nice.
these days. We have more options to where we can make them more potent.
Okay.
And so for guys, that was the limiting factor for a long time, is just they weren't potent enough.
Yeah.
Females the cream's such a tiny dose compared to guys that it's a little easier.
Okay.
But, so I use injections or creams. Sub-Q or IM both work.
Okay.
Testosterone is oil-based, and so some people will get a little bit of nodules doing sub-Q.
Yeah.
But it's still an option.
Yeah. Subcutaneous in the fat?
Yeah,
Really?
Fatty tissue, yeah.
In the stomach right there?
Mhm.
Interesting. I didn't know that. Okay.
They can do that.
Yeah.
And creams are applied 1 to 2 times a day.
Yeah.
Females do pretty good just doing it once a day.
Where do you apply the cream usually?
Yeah, typically pelvic area.
Okay.
Honestly, like guys are scrotum specifically.
Really?
Yeah, the
Whoa.
skin is thin.
Okay.
There's a lot of vessels. That's
Makes
the way to get
sense.
the best levels from a topical testosterone.
Yep.
It also limits axonal transference to women and kids.
Oh,
It
right.
is so potent.
Didn't even think about that.
Yeah, you're not typically accidentally touched your scrotum, but yeah.
Yeah, that's right. Yeah.
And so it makes it's just so potent that they just don't need this
Yeah.
amount of exposure. I mean, like I'll use creams for women, but
Mhm.
it's a fraction of the dose
I see.
compared to guys. Same with the injections for women. It's just a small dose. And so
Yeah. So with women, typically, are they doing the subcutaneous over the intramuscular?
most of the time, yeah.
Really? Okay.
And it's wherever's easiest.
okay.
Shoulder, side
Mhm.
of your thigh, butt. I like what's called ventral glute,
Mm-hmm.
but that's kind of a harder one to do. It's just not a big of a...
What's ventral glute?
Yeah, it's like, so it's right in front of you have your hip ball here,
Uh-huh.
your crest. And if you lean that way, you can feel this
Oh, I know
muscle
what you're talking
flex.
about. Yeah, I know exactly what you're talking about.
And you
I
go
didn't know
right
it was
there.
called that.
Yeah,
Cool.
there's not as many vessels or
Yeah.
nerves, and so it's a good spot to do it.
Yeah. So my buddy that I mentioned that I work out with, he told me, he just started with you. And he told me he was doing it in his shoulder.
Mhm.
And I said, really? I thought it would be in the glute. I don't know why. I just thought that. And I said, does it hurt? And he said, kinda. And I asked him if he was doing it himself or if y'all did it. And he said, no, they do it. And I didn't know that. I thought that if you went to your clinic and you're put on it, you do it yourself every week. But some people go to the clinic and do
Say
it.
98% of our patients do it at home.
Oh, okay. Okay.
Yeah, we just
okay.
work to do it.
I thought so. Okay.
A lot of them we work with them until they're comfortable.
I
enough to do it
got
at
you.
home.
Well, that's cool. Yeah.
And shoulder's good, and a lot of times it's because we're using a much smaller needle than traditional, bodybuilders, and
I see.
even the normal PCPs can still give them this harpoon of a needle.
Yeah, it's like a 1.5 inch.
You don't need
gauge,
you don't need that at all.
Really, that's good. Okay, yeah.
Yeah, it takes
That's
a little
cool.
bit to draw up, but it gets in just
I'll bet.
fine.
Yeah. Okay,
And not
cool.
much. I mean, it takes 15, 20 seconds.
Oh, yeah.
So it's not
Man,
too
that's
much.
good to know.
Much more comfortable. Make it to where injections sound intimidating.
Yeah.
But I mean, we have the majority of our patients on injections, and they do just fine.
Is it weekly?
2 to 3 times a week,
2 to 3 times a week. Okay.
depending on what's called sex hormone binding globulin. Typically helps
Whoa.
guide me a little bit.
What is that?
It's how your testosterone is transported.
You can tell that.
Yeah. So
Interesting.
just an initial evaluation, I'll get a total testosterone and then a sex hormone binding globulin,
Okay.
so I can calculate your free testosterone.
Oh, I see.
And the free testosterone is really what gets you symptom resolution a lot of times, rather than just a total testosterone.
What is free testosterone? Is that like the body's actually using?
Yep,
utilizing?
exactly.
Okay.
So
Yeah.
it's like I have some guys who have what look like really decent testosterone levels. Just say they're 600-700. That
Mhm.
sounds like a good testosterone.
Yeah,
level.
it does.
But they have what's a high sex hormone binding globulin, and so they have a low free
Oh.
testosterone still. So it's like you have a bank account with $1 million, but you can
can't
only
access.
spend a couple hundred.
Oh, that's a good
a month.
analogy. Okay.
And so
Yeah,
you have the bank there, but you're just not spending it.
I got
and
you.
so you don't get to reap the benefits of $1 million.
Dang, that's interesting. Yeah.
And so that's why
Wow.
sometimes the numbers again don't always correlate with symptom
Uh-huh.
resolution. And there's other just much more in-depth things that we may cover at time,
Mhm.
like CAG repeats and
What's
stuff.
that?
It's supposed to be how sensitive you are to androgens and stuff, and why some people.
Does that have to do with like gynecomastia and stuff like that? I
Not
wanted to
quite.
talk
This is
about
more on like a cellular level.
that. Okay.
But like the gynecomastia is the fancy term for man boobs.
Yeah, talk about why that
Yeah.
happens. So, from what I understand, is from my bodybuilding days is when you put synthetic testosterone in your body, it suppresses the natural production of testosterone, which increases estrogen, which can cause gynecomastia.
In a sense. So like, let's back up and say with guys don't have an estrogen producing organ.
Okay,
we
right.
get our estrogen from the conversion of testosterone to estrogen.
That's right. Okay.
And so estrogen's really been demonized in terms of all the negative side effects associated with testosterone, that you're going to get man boobs, you're going to cry at everything. And truthfully, I don't prescribe estrogen blockers.
Oh, you don't? I was going to ask you that.
You don't need them with appropriately managed testosterone. And like, gynecomastia is a more complex interplay of various hormones, testosterone, estradiol, prolactin, IGF-1. And so you don't need to block the estrogen. Like, honestly, elevated estrogen levels should be celebrated because you get better cardiovascular protection, you get better bone protection.
Okay.
Probably 50 to 60% of elevated testosterone benefits we are perceiving as more of the elevated estrogen.
Wow.
Better for mood.
Man, I didn't know
libido.
all that. Yeah.
And so a lot of guys, bodybuilders, everything, they'll crush their estrogen.
Yep.
And they'll have joint pain. Erectile difficulties.
I've seen and heard about that, man. That's crazy.
And so really shouldn't be crushing it or even really manipulating.
Okay. Is that common for other people who do what you do? Do you think there are doctors out there who are prescribing what's it called? I forget the names of the estrogen
there's like
blockers.
Nastrozol, which is Arimidex or
Arimidex. Yeah.
Nestazol
or something. Anyway,
and so truthfully working with, I would truthfully say not the online clinics. The online clinics, you're going to go in, you're going to be a number, and they're going to put you on a dedicated protocol, which is typically terrible. A testosterone protocol, which again typically sucks. Then they want to push an estrogen blocker, which again is too much. And then they want to put you on some of the other med in the background to keep your testicles from shutting down. And they promote it as like kisspeptin, enclomiphene, gonadorelin. None of those are strong enough to bypass a suppressed hypothalamic HPTAX.
Yeah. Okay.
And so they're just selling you more stuff that you don't need.
Yep.
And so, I mean, that's a lot of times the benefits of going to like a provider owned clinic where, you'll have more individualized protocols. And,
that's right.
And monitor.
So those, we talked about that a little bit earlier. Do we need to wait a second before you get that one? Or are these? Oh, okay. Close-ups are still good. Okay. So the online ones, that, I mean, I see because I'm, looking into it now, I see it all the time. My algorithm has it in there. And so all the online ones, you said they're pretty cookie cutter, like you said, and they're going to, it's one size fits all type deal. They're going to prescribe you some testosterone, an estrogen blocker. So the benefits of going to someone like you, who is an in-person provider and who can customize what you need, what are the benefits over the online one?
Yeah, and it's just really accessibility. Like I would say, we get a lot of people that come to us because we have a HIPAA-compliant communication thing where patients will just text us with questions or, if they need a refill, that kind of stuff. And so we're very accessible.
I like that.
And then also just that you can talk with us.
Yeah, exactly. Right. Yeah.
I've had them bring their labs from an online thing and they're like, I got these labs. They didn't tell me anything about it. I don't know what I'm looking at.
Yep.
I started testosterone. I think I could be better, but they're not, I just can't talk with anybody to know about changing protocol or anything. And so that's just where we come in and provide a much more personalized approach and accessible for questions. Stuff.
Nice. And so what does it cost typically, like for somebody to do this, like right out of the gates and then monthly?
Yeah. So we get a comprehensive set of labs up front, and most of the time the primary care docs don't get all that I'm looking for. There's a few things that I would really like with, I get a baseline luteinizing hormone or follicle stimulating hormone or both, so I can see how well your pituitary talking to your testicles, so we could see if there's a disruption, and that helps make the diagnosis of primary versus secondary versus tertiary hypogonadism. That's way in depth. At the end of the way, it doesn't even really matter because testosterone therapy is what you need. So anyways, I get typically a comprehensive set of labs, which we charge $199 for guys, $225 for women.
Okay.
And then guys, we charge $149 a month.
Okay.
It includes the testosterone itself. It includes those labs. It includes the lab follow-up appointments.
Cool.
Supplies, access to us,
Man, that's a good deal.
And then women, they're $199 to $249, depending on how many hormones we're replacing.
Okay.
Women have more labs to monitor.
Mm-hmm.
We typically follow up with them more because we're kind of balancing more hormones with them and everything.
Gotcha.
And so that's kind of the cost that we do running through month to month.
Gotcha. Yeah. Cool. You want to turn that, and then I'll hit the. I can keep that running for a minute. One more thing I wanted to ask you though is about whenever guys come in, let's say they're in their mid-30s, what would be considered low, and what is normal, and what is high, and what do you typically see the most?
So, like I use LabCorp for the majority of my labs, and the range is 264 to 916. It's a pretty big range.
Wait, what do you mean? You never see it under 264?
No, that's the range, the normal range.
That's where you want to be. Okay.
That's the normal range.
Okay, normal range. I didn't know that. Okay.
And, the numbers give me a starting point, help guide and everything, but truthfully, it's symptom resolution. If you're 400 and symptomatic, we're going to get you going.
Yeah.
And some guys feel great just getting up to 700.
Okay.
Sometimes they need 900, 1,000.
Oh.
Sometimes
so
those high SHBG guys need 1,200,
Whoa, okay.
That guy that felt good at 700 may feel bad at 1,200.
Wow. So you can have too much and feel bad?
Mm-hmm.
Why is that?
It's just how much can we tolerate?
Yeah.
Like typically, one of the side effects people worry about with testosterone is that they're going to get angry or moody.
Oh, yeah. Uh-huh.
And
does that happen?
To an extent, meaning like if they're well managed, guys will only improve their mood. They feel
that's what
better.
I thought. Yeah.
They can address things better whenever things go wrong. They can deal with it instead of blowing up.
Yeah.
To a point. I mean, if you're getting your testosterone levels way, way high, because your gym bro is telling you how to dose it and everything.
Yeah.
It may be too much for you, and then you may be moody and agitated and that kind of stuff. So it's very individualized.
Okay.
So it's really it's just wherever is the best for you.
Yeah.
And so the numbers help guide, but they're not the end all say all. So it's kind of hard to really say we need to get you to a level of 800.
Right. Yeah. That's what I was wondering, if like you're shooting for a certain number or how that works, but it depends on the person.
I'm really shooting for symptom resolution.
That makes sense.
Wherever you feel the best
and
wherever's, medically managed appropriate, your blood pressure is not too high, your blood's not too thick, that kind of stuff, we'll try and fine tune that wherever's best for that individual person.
Okay. Lastly was is it true that you have to donate blood every once in a while?
And so we monitor it. If I find that your blood is running too thick, really I'm going to look more for an underlying cause. Yes, testosterone does cause you to produce more red blood cells, but the guys that are like kind of hyper responding to it, a lot of them I uncover sleep apnea. Sometimes they're dehydrated. Sometimes they've picked up smoking and haven't told me.
Okay, yeah.
Or they told me they quit and they, I'm like, I don't think you quit.
Yeah.
And I'm like, yeah, I know, I started back.
Yeah.
We don't live at altitude. If we live in Colorado, yours would look high all the time.
Oh.
I never want to discourage blood donation just from the benefit of the community.
Sure,
being in
of
the ER
course,
for so long. We always need blood.
Mm-hmm.
But from, medically telling people, I don't ever put anybody on a donation regimen.
Oh, okay.
There's always outliers in medicine. If you have, iron storage disease, that kind of stuff, those guys have to donate blood. But from a testosterone management, I'm not typically going to put you on any type of donation regimen.
Okay.
Without making sure they don't have sleep apnea, that
makes sense.
Quit smoking, that kind of stuff.
That makes sense. That's good to know. That was real good, man. So let's segue. Let's move into hair loss a little bit.
Yeah.
So this is something like, I'm telling you, I'm your primary guy because, I'm 39 and I need TRT, but also, like I said, and we talked about it. Man, my dad lost his hair in his 20s. I'm, barely started thinning when I was like 36, 37, and it's in the front and on the temples a little, and it's scary, dude, because I thought I was going to keep my hair.
Yeah.
So what can I do to prevent more hair loss, maybe to encourage hair growth?
Yeah.
That's not going to screw me up,
Yeah, that's a good question. And so I'll just kind of back up with testosterone.
Okay.
Testosterone's not going to make your hair fall out.
It's not?
Unless you're genetically prone. And it sounds like you're genetically prone.
Yeah. So
like,
it doesn't by itself make you lose hair. Like
not unless you have a genetic
Makes
component.
sense. Okay.
Like Jay Cutler, the bodybuilder, is still has a full head of hair.
He does, yeah.
And he was probably blasting.
Oh,
like
he
crazy.
talks about it, yeah.
So it's not going to make your hair fall out unless you're genetically prone. But if you're genetically prone, the things that we do, the easiest is probably topical minoxidil, which is like Rogaine.
Oh, okay.
That does do good. And then we typically put you on a essentially hair supplement, like a multivitamin, like Nutrafol or Viviscal is another. A couple of the compounding pharmacies have their own brands of, like Hair Force One is one that I've used on some. So anyways, typically we'll do that. And then the more systemic options, I mentioned earlier that I do not like finasteride.
Finasteride, man, that's sad to hear you say in a way, just because it is effective, right?
It is effective, but finasteride or
scary.
Propecia, Proscar, whatever you know it as, but you can get what's called post-finasteride syndrome. It's a small population, but it can cause permanent loss of libido, erectile difficulties.
Permanent loss of libido. That is terrifying, dude.
And even from a testosterone standpoint, when the guys have that, it's hard. You treat them with testosterone, but they typically are ones that need the higher ones to try and get any of that back.
Wow. Yeah.
Even if the medication has been stopped. And so I don't
scary, dude.
I don't use it at all in my practice.
I get
it. Oral minoxidil is an option that seems to be a little bit more safe than what we thought. It doesn't have any sexual side effects.
So talk about HIMS a little, because I've looked into that. I even went as far as to do to fill out the information online and close to doing it before my girlfriend and I talked about going to see you. Like we've planned this. We're going to do that for TRT and to talk about hair loss, to, fill out all of our options before I just jump into something like that. So what do they typically do, HIMS?
As far as I know, they're probably going to do some sort of finasteride, oral, topical. Even topical has some systemic absorption, so I still won't even do that. And, we won't do that. We'll put you on another thing. You can get like not a foam roller, but like the microneedler, where it's just.
Does that really work? My dad was talking about that the other day. That works, dude.
Yeah, anytime you can stimulate the hair follicle, that kind of stuff, it may stimulate growth.
Okay.
We if it gets bad, not even if it gets bad, before it gets bad, we do offer PRP.
What's that?
Where I draw your blood, spin it down, and then we pull the liquid portion of it, and I inject that where you're thinning and everything.
I've never heard of that.
And that's directly introducing growth factors, healing factors.
You're kidding.
And we've had a lot of really good success with that. Yeah.
You do that?
Yeah. Yeah.
Man, that's cool to know. I might do that.
Yeah.
If I'm
even from a prevention standpoint, it can help.
Okay. I never heard of that. Yeah.
It is costly. And so a lot of times it's, minoxidil, like the Rogaine, is pretty cost effective.
Yeah.
Anytime with hair, it is a long-term thing. So just kind of trying to set expectations. Like it takes 6 to 8 months for this stuff to start really regrowing, and regrowing. And so it's not typically like buy 1 month of Nutrafol to save your hair.
Right.
It's kind of ongoing treatment and evaluation. So, but it does help. I mean, if you like 1 month of optimization, maybe prevents 6 months of decline on the tail.
Yep.
I mean, I don't know. I can't make that definitively, but any ounce of prevention should help in telling and everything. And then again, we kind of talked about worst case scenario. You accept it, or you go
to hair transplant,
or you go to Turkey. Yeah.
What's funny is I've seen reels and videos where the guys are in Turkey with their suitcases in the airport. Yeah. And they all just got the hair transplant. They go together sometimes. And so they have the bandages on their bald heads and they got their suitcases. Which I'm not opposed to doing. How much is that? Do you know?
I have never priced it, but I've heard it's pretty cost effective.
Yeah, it's like
to
$2,000 or something.
Yeah, I think I've seen like 5 to 6, but that's with like airfare. And
well, then that makes sense. Yeah,
and it's pretty cool because like it's moving DHT. These are DHT sensitive. These are not.
Oh, okay.
So it's moving these follicles to here, so you're not as hormonally affected.
Nice.
And so that's pretty cool. We don't offer that, you know, but that's like,
wow.
We've been trying things, and you're either at the point where you're going to accept it, or you're going to go get a hair transplant. Depends on your goals. Some guys just accept it and they do just fine.
Right.
Some just really want to keep it as long as they
can. What
can.
would you do?
I don't know.
Yeah.
I have a pretty lumpy head.
I do too.
So I was bald.
I do too. I know.
I used to be buzzed as a kid, and it was just always kind of lumpy.
Yep.
It doesn't matter whenever you're a kid, but
I know.
I don't know.
Sucks.
Truthfully, I don't know.
Yeah.
We'll see.
Well, you mentioned that the hair loss thing, it's like, it's kind of for life, and you can prevent it from, happening and help it. Like, let's say I was probably going to go fully bald by 50. I might be able to push it to 60 if I do the right things. But with the testosterone, also, I wanted to mention, some people are afraid of the fact that TRT is a lifelong thing. And is that true?
So, I mean, truthfully, if you are symptomatic and you feel better on testosterone, we're fixing a deficiency.
Okay.
So we keep you on it long term. We don't psych you on and off.
Yeah.
Say you've done it for 3 to 6 months and you're like, man, this just doesn't fit my life anymore. I want to come off. Your body's not going to forget how to make it. Right. I mean, it'll kick back in, and you should land about where you were naturally, depending on how long you're on it.
Okay.
Like if you're on it for 10, 15 years straight, then you probably won't. You'll have that age-related decline anyways. Mm-hmm. It's typically about 1% a year after the age of 30. So if you're on it from 35 to 45, that would have been a 10% decline anyways.
Yeah. Mm-hmm.
But if you're on it just 3 to 6 months, you'll probably land back where you were. It just takes some time.
I got you.
6 weeks to 6 months.
Okay.
And it was like, it also affects sperm counts. Mm-hmm. And so if you're young and still building a family, then that's something we need to discuss too.
Oh, so being on it could affect that, huh?
Oh, yeah.
Oh, man.
Your body just, as soon as you inject testosterone, put the cream on, however it detects that you have more testosterone than it was making, it's like, I don't need to do this anymore. I need to, you can take over. And so it stops 2 hormones, LH and FSH, from your pituitary to your testicles. LH makes testosterone, FSH makes sperm.
Okay.
And so both of them, you're not making it at the time. So, we have that discussion before, but I can put meds and keep your fertility. Like HCG a lot of time will bring your sperm counts back up.
Okay.
I could add FSH if that's not doing it. But typically, if you're still unsure if you're going to build a family or not, I'll have guys do a sperm analysis and bank it. You can cryopreserve it.
Is that expensive to do?
One of the websites that I typically recommend to guys, and there's probably tons out there I just don't know about. Yeah. But I think it's like,
you don't keep it like in your fridge in the back. Or
no. Yeah. I think it's like $200 for the evaluation, which I like to get up front.
Yeah.
Just to see your counts prior. Because if they're poor counts prior, then we know that testosterone didn't affect it whenever we're trying to bring it back.
Yeah.
And then I think it's like, I don't know, $150 a year to store it. So it's really pretty reasonable.
It's worth it. Yeah.
And honestly, in young guys, I almost encourage it anyways, because then if you get a head injury, you get a testicular injury, you have good sperm to pull back from.
Yeah, for sure. Good insurance.
It's just an insurance policy.
That's good.
And
that's cool.
But like I said, I'm not going to, if a guy is suffering and has low testosterone, I'm not going to withhold testosterone from him.
Yeah.
I'll get him to do that, and then I'll put him on testosterone, and then I can bring in the ancillary meds if needed when they're ready to conceive.
That makes sense.
And so there's ways to mitigate it.
Okay, cool. And then lastly, let's talk about the weight loss. So the big thing for the last couple of years has been Ozempic, or what's the actual clinical name for it?
So semaglutide is the generic. And there's Ozempic and Wegovy. They're both semaglutide.
Yeah, that's right.
Ozempic was formulated for diabetics. They realized it has a great weight loss component. And so Wegovy is for obesity specifically.
Okay.
And then semaglutide is what we're using that we get from a compounding pharmacy to make it more cost effective.
Oh, okay.
And
Is
then-
it local? You get it from a compounding pharmacy or no?
No,
Or
none
you
of the
probably
ones here do
Okay.
sterile compounding for injection.
I got you. Yeah.
Or it would be awesome.
Mm-hmm.
But it's a lot of red tape and stuff.
Oh, yeah,
so
I'm
they
sure.
don't want to bring it on board. And then tirzepatide is kind of the same. Tirzepatide is Mounjaro and Zepbound.
Okay.
Mounjaro is for diabetes,
Mhm.
and Zepbound is for obesity.
Okay. Yeah.
And it has outperformed Ozempic. It's kind of
Whoa.
Gen 2 Ozempic these days. I'd really say
Really?
Gen 3, like these GLP-1s have been out for a long time. Liraglutide came out in like 2007.
Yeah.
So, yeah, they're still relatively new in the medicine world, but we
Uh-huh.
have since like 2007 of data that's almost 20 years now.
Wow. Yeah.
So people were,
Yeah, that's fine. Don't worry about that. It should be off now. Yeah.
so people were worried about it being too new and not learning the long-term side effects and that
Mhm.
kind of stuff. And truthfully, it just seems to be all the studies come out just show it to be more and more safe.
Well, that's
you know?
good. Good
Yeah.
to hear. Yeah.
And so, I mean, and just the fact of the weight loss alone improves health markers so much
Yeah.
that people were worried about, it's going to cause medullary thyroid cancer.
Oh, wow.
That was just pretty much in rat studies. We don't have
Okay.
the same GLP-1 receptors on our
Oh.
thyroid,
Okay.
but also, weight loss of 10, 20, 30 pounds decreases almost all of your
That's right.
cancer markers.
Exactly.
More
Yeah.
than just this one rare form of cancer.
Exactly.
So
Yep.
I don't worry about it in that regards.
Yeah.
And really, it's been so nice to have something that works.
I know, man.
know?
Revolutionary. So
Yeah.
are people coming in droves for that? Or, I mean, is it pretty popular?
It is. It's still pretty expensive,
Oh,
even
is
through the
it?
compounding pharmacy.
It is, right? Like $3,000 a month or something. I've heard it can be.
Through brand names.
Okay.
The compounding pharmacies, I mean, we charge $3.99 for 20 milligrams. The starting dose is
Okay.
2.5 milligrams.
Okay.
And so you can get 6 to 8 weeks, depending on how fast you escalate your dose.
I
I
see.
have some who
Yeah.
lose all the weight they want at the beginning doses.
Oh.
And I have some who need a little bit more just to start feeling anything. So we'll kind of escalate their dose
Okay.
until they start getting the appetite suppression. They're getting full faster. That kind of
Yeah.
stuff. But
okay.
you got to use these as a tool
Mhm.
rather than just relying
Just
on
like
these
anything else.
medications.
That's right, man.
Yep.
Lifestyle change, all that's important, right?
And they can help facilitate that
Okay.
because you just don't have that hunger drive that
Yeah.
you did.
Is that the main thing that's happening? Is this appetite suppressant? Or?
It's a very potent appetite suppressant. It improves insulin sensitivity,
Yeah, I
so
knew
it
that.
makes you kind of process sugars and carbs better. But it also has a big just craving control. Like
oh,
it's not a abuse deterrent medication like some of the other meds we have called like Antabuse, that kind of stuff that make you vomit whenever
Right.
you drink alcohol. But
yeah.
these just make it less interesting. Like I've
Okay.
had a lot of people
Huh.
who are like, yeah, I drink half a bottle or a bottle of wine a night. I
Uh-huh.
just kind of part of my life. And it's like, okay, well, one, be careful. These meds can cause pancreatitis. Alcohol can cause
Ooh.
pancreatitis.
Yeah.
Together, that risk is increased. I've never had anybody get pancreatitis, but I just let them know.
Okay. Yeah.
Be careful with it. Plus, if you're on a weight loss journey, alcohol is very calorie dense. And
Mhm.
so I'm trying to get you to do anyways. But on our follow up, they're like, just not as interested in it anymore. I
Yeah.
was having half a bottle to a bottle a night. Now I still may do it on Fridays
Mhm.
with company, but
Yeah.
I'm
That's
not
great.
needing it nightly anymore.
Yeah.
Cravings, it just helps where you just don't think about them.
Uh huh.
And I mean, my example is that at urgent care, they used to bring donuts on Friday every day.
Uh-huh.
And I used to think about them the whole time, all day. And then
Sounds like me.
I'd give in about 2 or 3, and then I'd eat whatever was left. But then I started on these, and I remember walking out and I passed them and there's still donuts. I was like, I didn't even think
Shut
about it
up.
all
Wait,
day.
so you've done it?
Yeah.
No.
Yeah. They're
What?
awesome. I mean,
You did it?
yeah.
And
Of
explain
course.
your experience with it.
Yeah. I mean, I may take a small dose forever as long as I can tell.
Why?
Just it
Dude, fascinating.
keeps you in control. I mean, truthfully, I have a bad habit of from the ER. You're just kind of busy all day, stressful,
Uh-huh.
go home and eat till I fell
Yeah.
asleep basically.
Is it sweets for you, or is it both, like salty stuff and sweets?
You
or
know,
what?
mine is
Binging?
it's like, well, I need to finish with something sweet. I'll get something
Yeah.
sweet, and then it's like, now I want something salty. Now I get something salty,
that's
and it just
kinda how I
comes.
am. Yeah. Okay. Yeah.
But these give me a backstop
Mm,
to where, like,
good way of putting it. Okay.
okay, if I start,
need that.
if I start downward spiraling,
Mm-hmm.
it at least gets me a backstop
Yeah.
to where I can stop.
Mm-hmm.
And
Cool.
so they've really helped me in my own
Yeah.
kind of health and weight loss journey.
I wouldn't have thought that.
And it's
Cool.
just, I mean, again, everything seems so safe from
Mhm.
it. There's a lot of fear mongering in the media, I think,
Yeah.
on it compared to the real compared to the results I've seen
Mhm.
in improving sleep apnea, improving lipid markers,
Mhm.
cardiovascular outcomes, and just helping people feel better,
Yeah.
you know, about their body composition. And
Yeah.
everything. Where I do really have to hone in on people
Mhm.
are, and I'll kind of out the entire deal, but older females in resistance training and protein.
Oh, how come?
On these, you have, it's almost mandatory that you have to do some sort of resistance training.
Yeah.
Doesn't have to be
that.
much. And then also get your protein in.
Is this because this is what I would think as a professional in this industry, is that when you do something like this and your appetite is suppressed, you're not taking in enough macronutrients, especially protein. So what happens is, although the scale might go down, your body fat percentage might go up, and your
Yep.
composition is changing negatively.
Yep,
Is that
you're
why?
exactly
Yeah,
right.
okay.
They're so good they go down, but it's just in an older adults completely. I mean, muscle mass is your ticket to longevity.
That's exactly right. I
And-
literally say resistance training is the fountain of youth.
It
know?
is.
Yeah.
Yep. And I don't want to sacrifice tons of muscle mass in an older individual
Yes.
for just some improved body composition.
That's right,
You know?
yeah.
And so I do want them to be in control of their eating habits.
Yeah.
And so we'll use them to help guide that. But I don't want them, if you're not eating enough, especially protein and everything, you're going to decrease your muscle mass. You're going
Mhm.
to worsen your bone mineral density.
Yep.
And they just need to be doing those anyways
Yep.
from a longevity
That's right.
standpoint. Just so that if you fall, you don't break a hip.
Mm-hmm.
2, you can get yourself off the ground.
Yeah.
I mean, falls and hip fractures are devastating.
Yeah.
And I mean, 50% of people who fall and break a hip, die within a year.
Is that true?
It's not the fall that kills them, but it's just the lack of mobility. Now they're
Yeah.
stuck in bed for
I didn't know
a
that.
month.
Yeah.
And so you try and get them up moving and stuff, but if we can prevent that,
Yeah, absolutely.
or if you do fall, that you just bounce,
Exactly. Yeah.
and then you get yourself back up.
Yeah.
I mean,
Mhm.
there's always these horror stories, especially here in Texas in the summers. You
Yeah.
fall, hot house. I mean, you can die
Yeah.
in one day,
Yeah.
So
It's crazy.
falls are a significant aspect to morbidity and mortality that people don't really think about that
That's
much.
right.
And so I just
Yeah.
don't want to, back to GLP-1s and everything, I just want to use them appropriate.
Yeah, for sure.
You don't want to give it to somebody, have them crush their appetite. They don't eat anything. They're not getting their nutrients. And now they're kind of weak and fatigue and they don't want to go do much. They're losing weight,
Mm-hmm.
but at a cost.
Yeah, exactly.
Where, we get a body composition every time they come in for follow up.
Cool. Yeah.
And we can see, okay, you're maintaining your muscle mass, you're doing good. And so that's another benefit of doing not an online
Exactly. Yeah. I
cheapest
like that.
one.
Mm-hmm.
It's like come in,
Yep.
work with us and getting a meal plan
Mhm.
and talking
Cool.
about your protein and not just shelling out meds to anybody and everybody.
Exactly. Yeah.
And so-
I wanted to know, so like with this medication, is it, how when you eat something sweet, it spikes your insulin?
Mhm.
Is it preventing that from happening or no?
No, I mean, that's
Okay.
a normal response.
Okay, yeah, I
And
thought,
so, but the abnormal response, in like diabetics,
Mhm.
is that they just can't bring it back down very good.
Right.
And so these make your insulin more sensitive, meaning it's
Okay.
just more effective. So
Okay,
it's able
okay.
to handle those spikes much better.
Okay. Yeah.
And if you can, avoid simple carbs, sugars, that kind of stuff, and
Yeah.
make those not as many spikes, but more kind of rolling hills.
Exactly.
Valleys.
Yeah.
It's much more better in the long term, anyways.
Yeah.
But I'm not gonna say that you can have to avoid cake forever.
Right, yeah.
That kind of stuff.
Yeah.
So, to answer the question, they just make it to where you can come back down to a normal level instead of hanging out up here too long.
Okay, I see.
And it not doing anything. It's actually shuttling it into your cells and everything.
Nice. Okay, cool. So if somebody's interested in TRT, hair loss, any kind of dermatological issues, or weight loss, what's the best way to set an appointment with you?
Yeah, you can self-schedule on liveoaktestosterone.com.
Okay.
And or you can call 325-777-0737 and
I'll put that information on the screen right here.
Okay, cool. Yeah, and then they'll get you on the schedule.
Okay.
And we're
nice.
pretty good these days. I think we're about a week or so out. So it's not terribly, you don't have to wait a terribly long time.
What about insurance? You work with major insurance companies?
I don't do any insurance. You don't do any? All.
Okay.
We're out of network on all of them.
Okay. Is that something you plan to do later? Or?
At this time, probably not.
Okay.
It's just a lot easier. And I mean, I'll see sick people if, that kind of stuff. I've done sutures. I mean, all my background. So I keep everything in there and do it.
Nice.
And I just do a cash base just so that you know what you're going to pay.
I like it. Yeah.
There's no hidden costs.
Mm-hmm.
Hey, I'm sick. Okay, we charge this. Mm-hmm. You come in and you get that for that price.
Yeah. Cool. Very fair.
There's not a lot of, and that's like, labs is my one example that I use the most with insurance, and why I don't even really want to accept or give them orders for other labs is because I had a few where I was like, okay, well, you can take your labs to wherever you want. You have to put diagnosis codes. Hopefully insurance will cover it. I charge $199 for my labs. I had guys come to me and say, I had to pay $1,200 for labs. Yeah. And they're like, insurance covered $800 of it, but I still had to pay $1,200. And it's like, I mean, we just charge $199.
Yeah, that's great. Yeah. Cool.
And that was one of the things. So I just kind of got to where I was like, you're just going to do it through us. That's just kind of part of it.
Yeah, that's cool.
Just because those hidden costs is like, man, we're already behind the 8 ball and trying to keep it as cost effective as we can.
Exactly. And your podcast, man, I think it's great. You talk about all this kind of stuff, but in more detail, and you break each one down, and even have like your dermatologist come on and other people. And how can people find that?
Yeah, that's I think my YouTube thing is as Live Oak Health.
Okay, I'll put that link for sure. But
I really just started doing that just to get more information out there. Free information on how to manage testosterone and I have guests on to tell, things in different ways. So it's not just for my voice.
Yeah.
And also I like, I've had a mental health, psychiatric nurse practitioner on.
Cool. Yeah.
I've had a therapist, so I like to talk about mental health, how to start resistance training if you've never done it.
Good stuff. Yes.
How to start running or walking if you've never done it. So just trying to encompass whole body thing without trying to, by just providing information.
Yeah.
There's no cost to watch a YouTube video.
Exactly. Yeah.
And then our social medias, that's just kind of how I keep those active, is I just break up 30 to 60 seconds from those longer form.
Cool.
And so those are a little bit more digestible for all of our shortening attention spans.
Exactly.
These days.
Yeah. Yeah, they're good. I like watching them.
Yeah.
Cool. So lastly, I ask everybody this: what are 3 things that you're genuinely grateful for right now in your life?
Oh, man, that's a good question. I mean, my wife, my kids, and just my business as a whole, I'm very blessed with loving wife, loving, beautiful kids, and just the team that I have. I'm just so thankful that they help me out in there. I mean, the lifeblood of the whole clinic and everything.
Nice.
So, those would be the top 3.
Those are good, dude.
Yeah.
Very cool.
Yeah.
All right, man. Well, thank you so much. Anything else you want to say to the audience before we get out of here?
No, if you have any questions, of course, reach out, text or call, whatever. We're happy to provide any information, help along the way we can.
Dude, thank you again, Mason. Yeah. This was great, dude.
Yeah.
Absolutely. Yeah. Thanks for watching, guys. We'll catch you next time. Take care. Cool. Thank you for tuning in, guys. Thank you, Mr. Collins, for coming on and talking about testosterone replacement therapy, hair loss, and weight loss. Remember, guys, if you're in the market